All right, hello. My name is Cameron Smith. I'm with RediMD, and what we are doing today, this is a presentation on telemedicine for y'all's workers' compensation injuries. I'm sure a lot of y'all already know we are a benefits provider for you guys, where you can log on, make an appointment with one of our physicians for colds, flus, coughs, sinus infections, things of that nature, and telemedicine with one of our physicians on your iPhones, iPads, computers, what have you, and the doctors will get your medicines in. Now, we're transitioning also, we're going to also provide injury care for minor ailments. Let's say, a fracture, like a foot fracture, or back sprain or ankle sprain. So the process is a little bit different since we're dealing with workers' comp injuries. So what I'm going to do is I'm going to show you guys real quick a code that you would use if you want to register for a workers' comp injury, but we've also simplified it where you can call into our office and you'll speak to, there's one person there that's specifically for your guys' account for workers' comp, Lachey. She will actually talk to you about the injury and register the injured worker real fast, and the injured worker can do it on their smartphones, tablets, the computer right there. The process is going to remain the same for you guys reporting an injury. The injured worker comes to you, you fill out the same necessary forms, everything, and then you can you call into RediMD and have them register and see one of our physicians. If it's a laceration or something, obviously that needs to go to the ER. So what I'm going to do, let me just show you real fast. When you would log in, y'all's code for benefits was one code, workers' comp is a different code. So even if you've already used our system for benefits, or the injured worker has, you call into the office first if you're going to use our system for the injury, and Lachey at our office will switch that patient with a click of a button from benefits to workers' comp. And so for a first-time user, they would go here, and they're going to put in that code, it's TASB. And then it's going to take them right here. Very similar. Let me just show y'all a couple things, and then hold on. We're still having to use the email. That's just in case we do need to send something to the injured worker, like the 73 if they want it. But all that we've already have all that set up through the system. So email-based, they're going to create their own password. They don't need to worry about the Skype ID. Then it's just the basic information. Since it's workers' comp, we don't need to know their family history, any of that stuff. Are they diabetic or anything like that? We just need the basic info. First name, last name, city, state, primary phone. We tell them put their cell phone, because if the physician needs to call them, they're going to call them on that cell phone. That's really about it. And then date of birth and gender. So that's all the information we need for workers' comp on the injured worker, and then our physicians will take it from there. So let me go back to where I am. And what I'm going to do is I'm going to bring on Dr. Homestead. A lot of you guys have seen him, but he is going to be the point person for this pilot program. We're doing a pilot for 6 months on this workers' comp with Del Rio and some other school districts around the state. So he is going to be assigned to you guys, since you guys are already familiar with him, and he is very experienced in workers' comp. So you're going to click log in. I'm going to use mine and make an appointment with him. Okay. Oh, man, what is going on? Sorry. I wasn't looking at the computer. Okay. Fortunately, you have to do this stuff. It's just because it's private information. And like I said, this can all be done on iPhones, tablets, computer, anything that has a webcam. I mean, obviously with workers' comp, phone calls will not work. They are going to have to actually physically be seen by Dr. Homestead. So they would log in after, if they're already registered, if they do this themselves or you do it using the code TASB, they'll make an appointment. But if they call in, Lachey will give them an appointment, and it would show up right here. It would say appointment, but I'm going to click one. We're going to take that one. That's Dr. Homestead. If it's after hours, they can call in, and then Dr. Homestead will take it from there and set him up if he needs to see him the next day or something. So it's just confirming everything right there, and like it's workers' comp. There is no $10 charge or copay or anything. So this is what it would look like if, say, they called in, and Lachey says, "Okay, I'm going to set you up with an 11:50 a.m. appointment, Mr. Smith." They would log in. After she would give them their login information, they would log in. This is what they would see, and they would hit go now. And they're going to see this right here. BP, pulse, temperature, that's not important unless, if you guys have it at the nurse's office and want to enter it, that's fine. I mean, blood pressure, yes, if you can, that would be helpful, because injuries, it tends to go up. They're still going to ask them about medication allergies in case they do got to prescribe something. And then right here, they would just briefly describe their injury. Again, like I've told you guys in the past, they don't need to write a book because they're not going to read it. Just slipped and fell, hurt my back, or numbness going down the back of my leg, or my shoulder, my hand hurts, whatever it is, they can just briefly describe it. And then they'll click next, and let's see. Okay, so right here, the patient will have to click start video. Our doctors can initiate it. Allow it saying, okay, there we go.
Hello.
Hey, Dr. Homestead, how are you?
Good. How are you doing, Cameron?
I'm good, sir. So we're live throughout the school district for San Felipe Del Rio. We have a bunch of nurses on the line. I've briefly talked about how the process would kind of work, where if they're already registered, they would log in, they would call in, let's say we'd switch them over. That's pretty much about all we've gone through. I've just showed them a little bit and told them I'd bring you on and let you take it from here.
Okay, great. I'm Dr. Homestead. I guess I can just see Cameron. So
That's it, yeah.
With RediMD, so I see a lot of the private patients. So we've actually been doing at RediMD workers' comp telemedicine since roughly 2008 through some specialized exam to the Department of Workers' Comp. Can you hear me okay, Cameron?
Yes, sir. Yeah, they're controlling the volume in here. You're good.
Okay, gotcha. And so, and actually, the state of Texas is now pushing workers' comp telemedicine, which is fantastic since telemedicine's been so successful in the private areas. So, and so one of the things that Cameron wanted me to talk about in the school districts on what kind of injuries are appropriate for telemedicine and in the workers' comp field. So we've actually been doing very complex impairment exams where patients have permanent back injuries by telemedicine. So pretty much almost all injuries can be done by telemedicine. Now, you can't do a laceration where you physically have to touch the patient, you can't, but any kind of mild head injuries, shoulder strains, which you typically see in school districts and all workers' comp fields as a back strains. We do tons and tons of back strains. Even back strains where they do have some radiculopathy, where some numbness going down their legs, you can actually do that as well. We can take them through exam and make sure it's not as severe like a sciatica versus a radiculopathy, which is not as severe. We do lots of those. Ankle injuries. We can actually all do any kind of trauma, like fracture. I'm not head trauma, but where you hurt your arms, wrists, or something falls on it. We can order Xrays, which is great. We can also order physical therapy as well. So the nice thing is it's very simple to initiate a workers' comp injury by telemedicine. We have two options. Cameron showed the option where you just basically log on and make an appointment. The other option to make it even simpler is we have several customer service reps. You can call two lines, my direct office line, or we have the RediMD line, the 888-RediMD-5. That's a special number for workers' comp only. You call in, Lachey or one of the customer service reps will actually help register the patient and actually get the patient all set up, get them an appointment, and actually connect with the doctor and answer any questions. The nice thing too, if you're already a current RediMD patient that uses in the private field, we can actually switch you over to the workers' comp as needed. So you'll be switched over, and through the workers' comp claim, you'll be considered a workers' comp injury, and then we can always switch you back as well. So our process is very, very simple. It's to make it simple for you guys. You've got an injury, you basically just send them our way, and we'll take care of everything. The paperwork through the division now, we can actually email the DWCs 69 and 73s directly to y'all. They don't necessarily need a patient signature. And then so we'll kind of go through right now kind of claims that we're doing through workers' comp. We're pretty much nationwide now with RediMD and workers' comp. We've done lots and lots of back injuries, shoulder injuries. I mean, I see maybe 2 or 3 injuries through workers' comp a day through, they'll be me in New York and Ohio, and we see lots of patients in California, some of our chemical companies and a lot of companies in the oil industry are using us, especially in remote areas. Good thing too is what we do is we try to get patients back to work. So we don't take patients off work a long period of time. We encourage patients to return to work. We give them good restrictions where they're able to do their job, but we'll also protect them. And as with RediMD, we can always send the prescriptions to the pharmacy, and we'll designate that as a workers' comp. That way, the insurance will pay for it, and the patient doesn't have to pay for it. And we've got a lot of experience through workers' comp telemedicine. Some patients ask, how can you do a musculoskeletal by telemedicine? But it's pretty easy to take you through the steps on that. Now, Cameron, do you think I've covered everything? You got questions for me?
I'm thinking out loud. So how do we get to this point with workers' comp? Like, it's because it's the ease of use for them here in Del Rio, or do you know where I'm going with that?
Yeah, so workers' comp essentially is just like telemedicine. There is a shortage of good doctors, especially a lot of workers' comp doctors are primary care trained that eventually learn workers' comp. One of the issues, they do have a workers' comp certification, but very few people actually go through that. Now, some of the specialists like surgeons, they know workers' comp as well, kind of through training as well. So since you don't have actually a formal program that teaches workers' comp, you kind of learn on the job as you go. And as you guys know, workers' comp's very complex. There's injuries, there's return to work, can the patient fix the job duties? There's a lot of legal, when the patient be taken off work, when they can't. And again, when the patient's off work, they're actually receiving benefits, which is unlike in the private. So there's some doctors that just don't know the field very well. So it's hard to get good, experienced doctors in workers' comp that are going to do a really, really good job and on timely. You can't really, when somebody has a back injury, you can't wait 2 to 3 weeks for the patient to be seen. They need to be seen very quickly and readily. Every study has shown when patients are seen sooner, they get better. When they understand, when they're with a doctor that understands the musculoskeletal and explain things very well to them, explain why they're doing things, the patient satisfaction is much higher and they do improve better. So the nice thing about telemedicine now is we can beam anywhere we need to go for workers' comp and all musculoskeletal, and that's really why telemedicine's really kind of exploded, not only through Texas. Texas is one of the founding states for telemedicine through UTMB and Texas Tech, but nationwide it's rapidly expanding.
Perfect. So, okay, so another question, I'm just thinking out loud again. So say an injured worker falls and lands on their knee and it's swollen. What if they need an X-ray? How are you going to handle that if they need an X-ray?
So very good. So I don't know if the nurses there have used RediMD. Very simple process. What we do is we actually see the patient. They fall on their knee. They could have a patella fracture, which can be very painful, swollen knee. Very simple. We actually send an email to we can send a prescription to their email, and it goes right to them, and they can take that to the hospital there and get the X-ray very quickly. We can order labs like that. We've been doing that for a long, long time with RediMD through the private. So the moving over the workers' comp is very simple on that. MRIs too, we can do that. Now, physical therapies, we can do that. Now, one of the questions we have is, hey, let's say you need to hand a case off. Let's say here's a patient, they hurt their knee. We basically give them light duty at work. We give them the proper medications. They're walking around pretty good. We send them to the proper restrictions to be back at work. They're getting better. Then they suddenly plateau and they're not getting better. Then we can order physical therapy as needed on them. That's simply a prescription. And Lachey, or one of our customer service reps, is very good about doing referrals. We can refer them for physical therapy. And then let's say, hey, it's time for an MRI. They do have a meniscus tear and it's a certain spot that would need a surgery. Then we can easily refer that patient over to the orthopedic surgeon. The nice thing on RediMD is we are bringing on some specialists through RediMD that can actually, it's very interesting. So let's say we get an MRI that's a questionable, does this need surgery or not? We can actually bring in a specialist through RediMD that's an orthopedic that could actually look at the MRI and talk to the patient, make sure there is a determination. In the Del Rio, there may or may not be a close orthopedic, so it's really nice on the patient to get that evaluation that, especially with shoulder, it's a difficult surgery to do. You have to have, the proper setup to do that. They can at least get an evaluation and talk to a very good specialist from Houston that knows shoulder very well, that's all he does is shoulder only, doesn't do any other joint, explain to the patient their injury, the proper treatment, what needs to be done. And that's really nice, a huge patient satisfaction because they didn't have to drive all the way to Houston. And then so he can offer suggestions. Hey, this is not a surgical case yet, but let's do this, this, and this. And then after that, hey, it becomes a surgical case. Well, most of these, one of the doctors we do this with is a faculty at UT Houston Medical School. So he's one of the orthopedic faculty. Well, he can refer, hey, I don't want to drive all the way to Houston. He knows he's going to know colleagues in Corpus or San Antonio or the closest town that, hey, the big question is, who do I go to? This is a shoulder. It's a little bit more serious of a surgery. It's just not run-of-the-mill orthopedic surgery. Who's a good person to go to? Well, our doctor will know the good doctors in that area, can make hey, you need to go to this doctor in San Antonio. He's really good at this surgery. Or let's say, and actually, there are some surgeries, some ankle fractures, some crush injuries that are really complex surgeries that there's even specialists in Houston that only do that. The general orthopedics, hey, that's a little beyond what I like to do. There's new procedures that we can do on that. Well, then again, we can make a determination. Is that somebody in San Antonio good for that? Or is that somebody that needs to come to Houston and it's worth the drive to get that surgery done? So there's a lot of things we can bring in to really help the patient. Again, we return the patient to work. We're there for the patient. We're treating very appropriately, quickly. There's no wait. And then with a specialty background, they can get all the care they need at basically a major medical center coming to you by telemedicine.
And then the doctors will let them know when their follow-up is and how all that process works from there?
Yeah, so our software is really nice. It basically, you go on there and after the appointment, you can basically click follow-up, and what happens, it emails the patient that they have a follow-up appointment, the time and date of their follow-up. And the nice thing too about telemedicine is, let's say somebody gets busy, they can't be seen right then. We can actually see you on some things on an iPhone. We can actually, if it's something simple, hey, I got a little abrasion, I'm using some over-the-counter medication. I want you to kind of get checked out. You can actually text and send a picture to our doctor and just do it like that if needed. And I just forgot I was going to tell you guys something. I forgot. Oh, also, yeah, I just remembered. So I'm available 24/7. My phone number, and Cameron can give it to you guys. The 281-633-0148. Let's say it's not even a RediMD injury. Let's say there's another workers' comp injury, another doctor's doing this and this and this, and y'all just had a question on the care. Yeah, please call me. We can discuss it. Hey, does this seem right, or this? Or if you just have questions about other injuries, or is this a potential injury, or hey, this is not really a work-related injury. We think this is more, they did it outside of work. Those kind of questions. always available. What do we do? How do we do on that when that happens? I've been a basically designated doctor and impairment doctor for 14 years, which we get all the, I'm used to doing these cases where you get a case. What's the extent of injury? What's the return to work? And is this injury actually compensable? And here, let's say a patient is injured, but it's an aggravation. Here the patient already had a bad knee and then they hurt it on the job. Is this a true aggravation? So any injury you aggravate on the job can become a compensable workers' comp, but there's always a question: did they really aggravate that to become a workers' comp? Very good at answering those questions. Been doing it for a long, long time, and we're here to help you guys and make. I know workers' comp injuries just kind of throws in a wrinkle in your day. Somebody gets hurt, what to do, and we can take all that off you guys.
So we're speaking to primarily the nurses throughout the district and some other employees that they're the initial contact when the injury happens. They know the process. So what do they do if they're on the fence? Like, I don't know if this is appropriate for telemedicine. What would you advise them to do at that point?
Call me 24/7. Now, I guess if it's 5 a.m, call Cameron, but otherwise me. I'm just kidding. Now, I'm available 24/7. Y'all have a question, what should we do? That's what we're here. That's what I'm here for.
Yes.
I mean, for you guys, we do the private and the workers' comp. I'm always available. Call me. We'll discuss the case over the phone. There's no initiation, no charge, no nothing. Hey, is this a appropriate case? And what should we do? I'm always available for those questions.
Okay, and like we stated earlier, the process for you guys will be the same. The injury comes directly to you. You fill the necessary forms out, and then, like Dr. Homestead said, you can call in our office, and we're going to send you guys a flyer, kind of like the benefits flyer, but it'll have that TASB code on it, and it'll have the RediMD 1-800 number on it. Miss English has that. We can email it out. We can send them to your campus, whatever, but like I said, it's pretty simple. You can just call in, and our office will walk the claimant through it. The other thing, Spanish speaking, how are we going to handle that, Dr. Homestead, with Spanish?
I speak a little bit of Spanish, not enough for a workers' comp injury, but my office is 90% everyone here speaks Spanish, because 60% of my practice is workers' comp. So we have plenty of Spanish-speaking people here. We have plenty of Spanish-speaking doctors and physicians assistants that actually are going to practice, do the workers' comp telemedicine. Initially, it's just essentially going to be me doing it to make sure y'all are comfortable with everything. And if needed, we can always add doctors that can, and a lot of those will speak Spanish.
And you're okay if they have a family member on their end interpreting for them, correct?
A little bit. We can do that. That's not an ideal scenario.
Okay.
We much rather have somebody in my office actually interpret. It's just better to do that. I have an office person interpret. Rather than a family member. It's more professional, and it's better to do that. Yes.
But I guess what I meant was we'll have one on our end, but if they have someone on their end they want to explain, they can at the same time.
Yes, of course.
To
yes,
them,
they can
directly to them. Okay. I think we've covered about everything. Like I said, Laura will send out, Miss English will send out an email with the flyer, and this is, a pilot program through TASB, like I said earlier, with other districts around the state to try and provide, I guess, faster and more reliable workers' compensation service to the district. I think I've about covered everything. You got anything else, Dr. Holmson?
Yeah, just quickly. So I want to make sure Miss English gives everyone my email and my phone number. I know questions are going to pop up. Sometimes email's better. Just email me a question and I respond very quickly. Any question you have, we can get. I've answered every question probably 50 times. So I've got a good answer. Just email it to me and we'll get it answered for you. Okay.
All right. Well, that's it. Thank y'all for your time today. And like Dr. Holmson said, if you need anything or have any questions, we'll send out an email and you can contact him and we'll go from there. All right. Thank you.
Thank you, guys.
All right. Bye-bye. And if they forget to log out, if it's on the school computer, it'll kick them out after 15 minutes. And that's it. Thank you.